Welcome back in. Do you have a cough that just won't go away? It could be something serious. Dr. Chris Jahraus joining us now from Generations Radiotherapy and Oncology PC. And first off, Dr. Jahraus, how are you doing today?
I'm doing well, thank you. Thank you for having me.
You bet. So we're talking lung cancer screening, and we want to know who's really at risk for developing lung cancer.
Obviously, smokers are at the greatest risk, although there are other people who can develop lung cancer. Smoking far and away is the #1 risk and cause.
Well, what can be done to screen for lung cancer?
So the United States Preventive Services Task Force has recommended yearly lung cancer screening with low radiation dose CT scanning for people who have a history of heavy smoking, such as smoking, say, a pack a day for 30 years, something like that, and who now smoke or have quit within the past 15 years and who are between the ages of 55 and 80. And so for those people, we can do a yearly screening for lung cancer, much as we do for mammograms and breast cancer.
Yeah, and I know that if you find lung cancer, you, of course, are going to treat it, but you really want to find this earlier rather than later, right?
Exactly. The earlier it's found, the more effective we can be in treating it. And that's the thing. People often say, well, you know, I don't want to know. Mm-hmm. But in reality, knowing is the best thing because it allows you to manage it. And there's some very successful treatments available.
Well, what type of options are there? What kind of treatments are out there?
So surgery is probably the most common treatment, but an equally effective option exists, and that's called SABR, or stereotactic ablative body radiation therapy. With SABR, we actually use an array of very well-targeted beams, and we even analyze things like the motion that a tumor makes when a person breathes, and we can effectively destroy that area, that small cancer, if it's caught early enough, with very modest side effects.
How successful or is SABR?
So SABR is as successful as surgery in early lung cancer cases. So if you have a lung cancer that has not spread and that is fairly localized, the outcome is a cure in as many as 4 out of 5, maybe even a little better occasionally. It just depends on when it's caught. So very good odds.
Yeah, where can a patient get SABR? Where can that be done?
So all of the major hospitals in town have the ability to do SABR, and certainly here at Shelby Baptist and Generations Radiotherapy, we're very proud to offer that and are even coming out with some advancements in the coming months for doing that more efficiently and faster, so with greater patient comfort too.
Yeah, and how successful is that SABR treatment?
Like I say, it's the same as surgery in terms of outcome. Right. For a small lesion, you're looking at somewhere in the neighborhood of 80 to 90% cure. And the best part is that for a majority of patients, they have very few, if any, side effects. Many experience no side effects from it that are noticeable. So it's a great treatment and a great option for the right patient.
All right, I do appreciate it, Dr. Chris Jahraus, joining us this afternoon. We appreciate your time on such a very critical treatment when we're dealing with lung cancer. Thank you so much for being with us.
It's my pleasure. Thank you.
You bet.